Causes of infertility in men and women, treatment methods. In recent years, the list of socially significant problems around the world has been replenished with infertility. According to statistics, 15% of fertile couples cannot become parents. Despite the fact that many cases are associated with the violation of women's health, doctors note the growing rates of reproductive failure in men. In the field of gynecology and andrology, the search for new methods of treatment does not stop. Reproductologists solve the problem with the help of modern medical technologies, IVF, excision. The absence of children often becomes the cause of a tense situation in the family, mutual reproaches. Painful attitude to the situation is invariably accompanied by questions, why us? What to do about it? What is infertility? The term infertility is clear to everyone and does not need to be deciphered. But in medicine, there is a clear idea of who fits into the category of patients with such a diagnosis. These are people of reproductive age with the violation or lack of fertility. A couple, male and female, who regularly has sexual intercourse is considered infertile if pregnancy does not occur within 1.5 years. The inability to reproduce offspring is officially considered a disease. His treatment is carried out by gynecologists, andrologists, urologists, reproductive specialists. In most cases, endocrinologists, geneticists, immunologists, and nephrologists are involved in the diagnostic and treatment process. Male infertility is often defined by the concept of sperm fertility, which has nothing to do with erectile dysfunction. Good potency and inability to fertilize are compatible conditions that often occur in clinical practice. Female infertility is primary when there are no pregnancies in the gynecological history, and secondary if the woman cannot become pregnant again. Regardless of gender, fertility disorders are relative and absolute. In the first case, the pathology is curable. In the second, conception is impossible due to irreversible congenital or acquired changes in the reproductive system. According to statistics, 40% of cases are male infertility, 49% are female. The remaining 11% are due to immunological incompatibility of partners. Causes of infertility in men. Violation of fertility is often associated with structural pathologies, obturation of the reproductive organs, as well as secretory dysfunction at any stage of spermatogenesis, the maturation of male germ cells. Less common is an autoimmune form of infertility, a pathology in which the immune system takes spermatozoa for foreign agents and destroys them at the maturation stage. The reason for the lack of pregnancy may be erectile dysfunction or violation of ejaculation, retrograde ejaculation, ejection of semen in the proximal direction, into the bladder. Obstructive form of infertility. Obturation, obstruction of one or both vas deferens. Causes of stenosis, narrowing, or complete blockage of the lumen of the ducts. Cysts, abscesses, injuries of the genital organs. Inflammatory diseases, funiculitis, vesiculitis, prostatitis, orchitis, or chephadenitis. Inflammation is often caused by sexual infections, gonorrhea, trichomoniasis, chlamydia, etc. Secretory form. The level of secretory fertility depends on the quality of the seminal fluid. Pathologies of spermatogenesis are manifested by a deviation of the biochemical parameters of the ejaculate. Reduced activity, poor mobility of spermatozoa, astenospermia. Empty seminal fluid, devoid of sperm, azoospermia. Deterioration of the morphological structure of the sex gametes, malformations of the head, tail, teratozoospermia. Reduced sperm count in the ejaculate, oligozoospermia. A combination of weak activity with structural disorders of germ cells, astenoteratozoospermia. Combination of low concentration with low activity and morphological defects of sperm, oligoastenoteratozoospermia. The formation, maturation, development of male gametes occurs under the control of hormones that are extremely sensitive to exogenous effects, internal disturbances in the functioning of the body. Causes of sperm pathologies. Hypothalamic pituitary insufficiency is a hormonal dysfunction in which the production of sex hormones is reduced. Hypogonadism is a functional insufficiency of the gonads. The primary form of the disease is associated with changes in the tissues of the testicles, the secondary, with damage to the pituitary gland, brain tumors, traumatic brain injury, etc. Varicocele, varicose veins of the testicles. The synthesis of spermatozoa in the testicles is reduced due to the stagnation of venous blood. Dropsy, accumulation of fluid in the testicles, which squeezes them, disrupts the blood supply. Cryptorchidism, developmental pathology, testicular retention in the abdominal cavity, undescended. Congenital anomalies, anarchism, absence of testicles, monarchism, one testicle. The work of the male gonads is negatively affected by overheating of the testicles, prolonged stress, nicotine and alcohol addiction. Infertility in men often becomes a complication of paramyxovirus, mumps. Causes of fertility disorders in women. Female sterility is explained by the presence of one or several disorders at once: anatomical, hormonal, inflammatory, oncological, postoperative, immunological. Inflammation. Infertility is directly related to advanced inflammatory diseases of the reproductive organs, the cause of which is infections, including sexually transmitted ones. Women suffer many infectious diseases with minimal symptoms, so they are found in the chronic stage, when the entire reproductive system is disrupted. Dangerous pathogens include chlamydia, trichomonas, gonococci, ureaplasma, herpes type 2, pale spirochete. Untimely diagnosis leads to the development of inflammation, oophorithitis, salpingitis, salpingophritis, metritis or endometritis. Hormonal factors. An equally significant factor in fertility disorders is anovulation. The egg does not mature or does not leave the follicle, so there is no ovulation. The reason is hormonal disruptions that regulate the ovarian menstrual cycle. Damage to the hypothalamic pituitary zone, hormonally active tumor, prolactinoma. Ovarian dysfunction, underdevelopment, early exhaustion, polycystic disease, advanced oophoritис. In addition to anovulation, the causes of infertility are various types of ovarian menstrual cycle disorders, OMMC, menorrhagia, opsymnuria, polymenorrhea, amenorrhea, etc. The stability of ovulation is affected by endocrine disorders, thyroid diseases, hypothyroidism, hyperthyroidism, adrenal pathology, hypercorticism, hypocorticism, cortical hyperplasia, obesity, as well as a sharp change in body weight in any direction. Obstruction. Tubal infertility is caused by obturation of the fallopian tubes due to congenital malformations or adhesions formed as a result of chronic inflammation, salpingophritis, salpingitis. Cervical factor, obstruction of the endocervix, which can be caused by deformation, cervical dysplasia, the formation of cervical polyps, a change in the composition of the mucus. Violation of fertility causes the growth of endometrial tissues beyond the anatomical limits, endometriosis of the ovaries and uterus. Uterine causes. Lack of pregnancy is often associated with structural defects of the reproductive organ. They may be congenital or acquired. The mistakes of nature include hypoplasia, anatomical failure, underdevelopment, doubling of the uterus, the presence of two separate uterus and two bifurcated vaginas, bicronuate, split, or saddled uterus, longitudinal or transverse intrauterine septum, acquired defects, fibroma, myoma, endometrial cancer, postoperative or post-traumatic cicatricial deformity of tissues, Asherman syndrome or intrauterine adhesions, synechia. Immunological infertility. It occurs as an inadequate reaction of the female immune system to the seminal fluid of a man. Immune cells mistakenly perceive spermatozoa as dangerous agents for the body. In response, the system starts the production of anti-sperm antibodies that make it difficult for the egg to be fertilized. Symptoms. There is only one sign of infertility, the absence of children during an active sexual life without contraception. Any accompanying symptoms are manifestations of the causes of fertility disorders. Hormonal changes. Tumors, endometriosis, heavy menstruation. Dyspareunia, pain during and after intimacy. Infectious and inflammatory gynecological diseases, itching and burning of the genitals, pain in the lower abdomen, hyperthermia. Leukorrhea, nonspecific discharge from the vagina. In men, the obvious symptoms are congenital anomalies of the testicles, signs of the development of varicocele, dropsy. Diagnosis of infertility. Common diagnostic methods for men and women include collection of anamnesis, transferred sexual infections, inflammatory diseases of the reproductive sphere, operations, injuries in the groin, head, complaints about the current condition, hereditary diseases. Survey. Intimate information, age of onset, activity, libido, orgasm, previous contraceptive methods. In men, they find out the features of ejaculation. In women, information on the number of pregnancies, childbirth, abortions. The doctor needs to know about the nature of menstruation, age of menarche, irregularity, pain, duration, volume of menstrual blood. Examination of the skin, oral cavity, palpation of the lymph nodes. Visual assessment of the condition of the genitals. Gynecological examination complements the bimanual examination of the uterus, ovaries. Collection of urogenital smear and venous blood for all sexually transmitted infections. Ultrasound of the pelvic organs. Male diagnostics is supplemented by ultrasound of the prostate, scrotum. In pathologies of the endocrine system, MRI, CT, of the brain is prescribed. Laboratory diagnosis of infertility includes a number of tests depending on gender. Men donate blood for sex hormones, adrenal hormones, spermogram, 2-3 times for an objective assessment. With suspected autoimmune infertility, a blood test for anti-sperm antibodies is performed. In women, the examination plan is wider. A smear on the microflora of the vagina. A smear from the cervical canal, a blood test for anti-sperm antibodies. Functional tests. Measurement of basal temperature during the menstrual cycle to study the temperature curve. Compatibility testing, assessment of the number and motility of spermatozoa in the cervical mucus after intercourse, postcoital test. Thyroid examination, ultrasound, blood test for hormones, T3, T4, TSH, and antibodies to thyroperoxidase. Examination of the adrenal glands, blood for hormones, cortisol, aldosterone, dehydroepiandrosterone, ultrasound, urine test for TS and 17-ketosteroids. Blood test for sex hormones, prolactin, estradiol, follicle stimulating, luteinizing, etc. Hormonal tests with the introduction of drugs, progesterone, estrogen gestagen, clomiphene, etc. Hysterosalpingography, X-ray diagnostics of the fallopian tubes, the uterine cavity to assess patency. Folliculometry, triple ultrasound of folliculogenesis. In some cases, surgical methods, hysteroscopy, laparoscopy, help to determine the cause of infertility. Traditional treatment. If infectious diseases are detected, course therapy with antibiotics, antiprotozoal drugs or anti-inflammatory drugs is carried out. Hormonal treatment of female infertility is based on drugs that increase the synthesis of follicle-stimulating hormones that control the process of ovulation and endometrial development, as well as analogs of natural sex hormones. Surgery is indicated if organ defects. Women and men undergo reconstructive plastic surgery. Endometriosis, neoplasms, cysts, polyps, benign tumors. In most cases, laparoscopy is used. To stimulate spermatogenesis, vitamins with the high content of zinc are used. Hormone replacement therapy according to a personal scheme is prescribed if endocrine pathologies, hypogonadism, hypoandrogenism are detected. With dropsy of the testicles, cryptorchidism, varicocele, a minimally invasive operation is performed. Additionally, physiotherapy methods designed to improve the functioning of the reproductive system are used. Reproductive medicine technologies. If pregnancy does not occur after the treatment, it is recommended to contact reproductologists for the selection of auxiliary medical technologies, methods of artificial insemination. In clinics that specialize in the treatment of infertility, the following methods are practiced. Insemination with donor sperm, IISD, or husband, IISM, is the introduction of seminal fluid obtained in the laboratory into the endocervix or uterine cavity. The technique is used for male secretory infertility and under the condition of complete patency of the fallopian tubes of the partner. In vitro fertilization, IVF. In vitro fertilization, conception and early stages of embryogenesis outside the mother's body, with further placement of the finished embryo into the uterine cavity. For the procedure, partner's biomaterial can be used, donor eggs, embryos. Intracytoplasmic sperm injection, ICSI. A subspecies of IVF, which is often used in a comprehensive in vitro fertilization program. Indications for IVF in women. Absence of fallopian tubes as a result of surgical removal in case of severe inflammation or tubal pregnancy. Absolute obturation of the fallopian tubes. High risk of ectopic pregnancy due to tube abnormalities, elongated, curved, with areas of stenosis or expansion. Indications for IVF in men. Obstructive form of infertility, if the operation was unsuccessful or impossible due to personal contraindications. Retrograde ejaculation, the reproductive specialist receives spermatozoa from testicular tissue. Erectile dysfunction, not amenable to stimulation with special drugs and dietary supplements for men. IVF with the donor egg is recommended in such cases. Female infertility due to the absence, removal, of the ovaries or pathologies of the gonads, premature aging, developmental anomalies. Lack of fertility in a man due to azoospermia. Unsuccessful attempts at hormonal stimulation, follicles do not mature, there are very few of them, 1-2 pieces. The risk of transmitting genetic mutations to the child through the maternal line. It is recommended to use a donor embryo if there is a high risk of the child inheriting serious diseases from both parents. Inheriting serious diseases from both parents. Inheriting serious diseases from both